Now, a couple testing guidelines that are important. First, we always test the stronger leg first, or the non-operative leg first. The first time she jumps should be maybe a 50% effort. We'll usually have her do a couple of practice ones at 50%, 75%, and then the third time would be giving her maximum effort to do this jumping test. She's allowed to kind of use her arms to create momentum as much as she wants to. We start with the toe behind the line. We take the measurement to within the nearest centimeter using a tape measure. A failed jump would consist of her losing her balance when she lands, touching the floor with her hands or her arms or with her opposite leg, or when she sticks that landing, having an additional short hop. Those would all be considered a failed test, and we'd have to repeat the test. Once again, no restrictions given on her arm movement at all. So you would just, the first jump's just going to be like a little half effort, jumping, landing on one leg, sticking the landing. And she'd go back, start on the tape again, and this one would be maybe a 3/4 effort, maybe a little bit more of a jump, stick that landing. Good. Wobbling is okay, but we want to see that landing controlled. And then this is going to be her max jump. Boom. She sticks the landing. And then you would just take a tape measure and you'd measure right to the heel, to the nearest centimeter, how far that she went. And that's on her strong leg. Then we'd retest it. She'd be standing on her bad leg or operative leg. Same thing. The first one would be just a medium 50% jump just to get the feel of it. Good. Second one would be loading up a little bit more, but still not max effort yet, just still getting the feel of it, sticking that landing. Good. And then third jump is get her arms involved, real good jump, real good landing, stick that landing. Good. And we once again would just take a tape measure and measure in centimeters to where her heel was. Now then what we do is we have to calculate something called a limb symmetry index. We do this by dividing the operative limb average by the non-operative limb average and then multiplying by 100. And in order to pass this test, we want to see, our patients performing at least 90% distance compared to the stronger leg.